Until the 1980s, most congenital heart defects were only found after birth, often too late to plan. That meant families and surgeons faced urgent life-saving choices with little prep. Then fetal echocardiography arrived, a new way to see the fetal heart before birth. Pioneers like Dr. Lindsay Allan in the UK and Dr. Christopher Rudolph in the US showed detailed views were possible. They demonstrated clear cardiac anatomy as early as 18 to 22 weeks. By the 1990s, fetal echo became standard in high-risk pregnancies. It changed how we managed congenital heart disease. It allowed earlier decisions and better outcomes. Early identification of critical defects, parental counseling and delivery planning, and in utero referrals to high-volume surgical centers. In some cases, diagnosis opened the door to fetal cardiac intervention. In the 2000s, teams at Boston Children's, Mayo Clinic, and European centers began fetal atrial septoplasty. The aim, open or enlarge the atrial septum in babies with HLHS and intact atrial septum. These high-risk procedures were offered only at select centers, but for some infants they extended hope where survival at birth was unlikely. They required expert teams, careful planning, and clear counseling. More recently, experimental fetal valve dilation aims to prevent progression to single ventricle physiology. The goal is to treat disease before birth, to change an infant's path entirely, but access remains uneven, tied to geography and insurance. Institutional expertise and training determine who benefits. Realizing the promise needs collaboration, training, and outreach. 1987, the first successful neonatal heart transplant at Loma Linda expanded possibilities. 1990s, ECMO, implantable pacemakers, and global training improved survival. 2000s to 2020s, catheter-based valves like the Melody and expanded TPVR reduced repeat surgeries. 2020s, remote monitoring, AI diagnostics, and hybrid cath surgical labs are changing care. Remote pulse oximetry and telemedicine let clinicians watch infants from home. AI helps detect subtle findings, accelerating diagnosis and referral. Hybrid labs combine catheter and surgical tools for safer, less invasive care. These advances changed lives, infants becoming children and adults with futures. Training new teams spreads that possibility worldwide. Collaboration across centers brings expertise to more families. The frontier of congenital heart care now begins in the womb. The promise is enormous, but depends on access, training, and teamwork. With continued innovation and outreach, more babies can get the care they need before they even take their first breath.